So we're here at one of the largest breast cancer conferences, and I wanted to know if there's anything that you're really looking forward to bringing back to your community to help to better assist patients and caregivers.
I'm looking at some of the phase 3 trials that were phase 1 or 2 last year that looked very, very promising. And we always have an update from the San Antonio Breast Cancer Symposium, normally in January, and for the community here. And we asked some of our local physicians to talk about what they saw, what they heard. So this year we're looking to see, okay, which of these trials are ready for prime time, which of them are really, really exciting. And there are a couple that are out there that are showing really good promise, but there's no actual long-term data. It's still like very few patients, but it looks very promising in these maybe 30 or 40 patients. So these are trials that are going to have to go further out and have a lot more patients involved, but hopefully some of these will, and I don't want to say the names because they're some of them are not actually available yet to say.
Okay.
But there should be information in the press center about some of them that are coming up. But like we'll have information out there, the trials, what's coming up, especially in the posters. There's a lot more this year on survivorship than there has been in the past, which is always great for advocates to take back, because it's like you're going through treatment, but not only does your body need to be treated, but your mind needs to be treated too. So you need to think of yourself as a whole person, not a person going through a disease. And so how can the doctors, how can the community help you through this situation? So whether it's complementary, whether it is being part of a support group, whether it is having patient navigators to help you guide you through the system. So we'll call here, well, no, that's not the right number here, call here. They can guide you and tell you exactly what number to call or call it for you. So those are all big issues that we will be taking back, that here's a resource. It's for this state, it's for that state, or it's a national resource. Livestrong has this patient navigation system that's for all states, and it's really good, and it's bilingual. So, here's something you can use. So, we'll tell them about things like that, and that's exciting because there's been very little about survivorship in the past.
Right. So it sounds like you guys kind of vet some of the information that's out there on the internet and everything like that for patients.
Yes.
That's a very good resource for them to have. Because
Yes.
we've noticed a lot of patients will research their condition on the internet and then be terrified.
Exactly. Yes. Yeah, because we don't put anything out there. We don't recommend anything unless our scientific advisors say, yes, this is good. Yes, this is showing really, really good promise. This is something you can have. Yeah. Talk about this one.
That's good. Great.